As a woman's body experiences childbirth and natural aging processes, the muscles and ligaments surrounding her vagina can become damaged or weakened, resulting in a condition known as vaginal relaxation. Symptoms of vaginal relaxation may include mild stress urinary incontinence, loss of muscle tone and functional control, and decreased sexual gratification for both the woman and her partner. Additionally, many women are dissatisfied with the aesthetic appearance of their genitalia. Irregular genital structures can be the result of hereditary characteristics, childbirth, trauma, and aging. Introducing Laser Vaginal Rejuvenation, or LVR, and Designer Laser Vaginoplasty, or DLV. Safe and effective cosmetic procedures that address vaginal relaxation as well as the aesthetic appearance of the vulvar structures.
Laser vaginal rejuvenation is a 1-hour outpatient surgical procedure designed to treat vaginal relaxation. Basically what we are doing, we are using the laser to do all the cutting and dissecting, and we are tightening the muscles of the upper part of the vagina, bottom, and outside. By doing this, we will enhance vaginal muscle tone, strength, control. We will effectively decrease the internal diameter, external diameter, and build up the perineal body.
We all know that childbirth is a blessing, but it certainly has some destructive influence on the birth canal. And what laser vaginal rejuvenation will accomplish is attaining a pre-pregnancy state or even a pre-virginal state of the vagina.
What we do is reconstruct or reapproximate the fascial support or the leathery, strengthening support of the vagina back into its normal anatomical position. This is done by making small incisions in the vagina, finding the fascial and muscular supportive tissues that have been pulled out of place and replacing them back, basically in the midline where they belong.
Your physician is a certified associate of the Laser Vaginal Rejuvenation Institute of America and has undergone a rigorous training program in order to perform LVR and DLV. Following a comprehensive examination, you and your physician will develop an operative plan specifically designed to meet your individual needs. Following this 90-minute procedure, you will be given post-operative care instructions and shortly thereafter be allowed to go home.
I have had 2 children, both of which were very large babies, and after that you just don't quite feel the same. Things, any kind of intimacy just isn't the same.
I just had a daughter 3 months ago, and things since haven't been the same. I wanted to correct a bit of the incontinence. I work out all the time. I'm exercising, running around. Having a little one isn't easy.
Showed up in the morning, they took me to the back, they prepped me a little bit, and just kind of talked to me for a little while and explained what was going to happen. They
gave me a little something so I can relax. The anesthesiologist was great. Once I was asleep, I woke up, everything was done, and I was ready to go home.
From the 3rd day, I was still down and in bed, and just that next morning, for whatever reason, I just felt so good.
Sex has been great. I'm a lot more confident. Exercising and everything is awesome. I can finish a whole workout without having to excuse myself to the ladies' room.
I'm not self-conscious anymore. I can leave the lights on. We can have a lot more fun, and it just brings out a confidence that I think every woman should have.
Designer laser vaginoplasty is a group of aesthetic laser surgical procedures designed to aesthetically enhance the vulvar structures.
There are numerous procedures that fall under the classification of designer laser vaginoplasty, or DLV. One of the most common ones is laser reduction labiaplasty. This is sculpturing down of the labia minora. There are many reasons why a lady might wish to get this done.
If she feels that the appearance of her labia is not as she would like it to, that's the basic concept. If she feels that her labia have thinned out over the years and that they're stretched, they're too loose. I have many women who want to have vaginoplasties because of the styles today. We wear many more tight-fitting clothing, and some of the women feel that their labia bulges in this clothing and is unsightly. Some women just dislike the appearance of their labia because of the shape of the labia, and they want to have the labia contoured a little bit more uniformly.
We have 3 techniques to reduce the large outer lips are the labia majora. We can augment the labia majora via an autologous fat transplant, where we remove fat from other parts of the body and then augment the labia majora for a fuller aesthetic look of the labia majora. We can perform liposculpting of the mons pubis and the upper portions of the labia majora as well. Almost anything that the woman desires on the vulvar structures, we can do.
I decided to have a laser vaginoplasty because aesthetically I wasn't very comfortable. I like to wear bathing suits in the summer, and I just wanted something that looked more feminine, smoother. I had a little bit of a bulge and doesn't really look attractive, and I'm just glad I followed through with it. I'm a lot more confident now and comfortable in my clothing.
Laser vaginal rejuvenation and designer laser vaginoplasty procedures are different from other conventional procedures because of the fact that we use a specially developed laser for the procedures. The procedures are outpatient, they're bloodless, painless, and you're back at work in 7 days.
What the laser can do is give you very precise surgical incisions in the vagina and the vulvar structures. Very clean, it cauterizes as it incisors or cuts into the tissue, so you're losing a lot less blood.
Which decreases tissue destruction, which then increases healing time. It's more rapid, and it also increases the ability of the tissue to reapproximate.
You're not going to have to stay in the hospital. You're going to get to go home. You're going to be more comfortable, and less blood loss means a quicker recovery and less post-operative problems for you as well.
The plastic procedure that's been incorporated is use of tumescent solution, which also helps to define the planes that we were dissecting. Therefore, we have greater ability to bring the proper tissue planes back together again.
All the closures of all incisions are based on the principles of plastic surgery. We want everything to be very symmetrical in the midline, very clean, very precise, and the end result is not only the improvement of form and function, but of appearance.
Your physician is a certified associate of the Laser Vaginal Rejuvenation Institute of America and has been trained to perform LVR and DLV. The Laser Vaginal Rejuvenation Institute of America, or LVRIA, is located in Los Angeles, California, and is the world's leading center of excellence in vaginal surgical techniques. Only physicians trained at the LVRIA are certified by the Institute to perform LVR and DLV. A complete list of certified physicians can be found at www.lvria.org.
Some patients don't even want to have sex anymore because they're embarrassed about the appearance of their vagina or even the feel of their vagina. Some patients have a decreased libido themselves, or they're embarrassed to have their husbands even look at their vaginal areas. So it can be life-altering that they suddenly now feel young again, that they feel that they are attractive vaginally, that their sexuality has been returned to them.
If there's any other women out there that are interested in having this procedure, definitely go for it, because it's an amazing thing, and I am so glad I did it. I do admit it's a bit uncomfortable to even bring up the topic. It's a delicate and embarrassing topic, but my doctor and his staff have made me feel so comfortable, and I'm just very glad I did it.
I'm so much more comfortable in my intimate relationships now, and the downtime isn't that much. You have a couple days and you're back to normal. The pain is very manageable, and if you are considering having the surgery done, I would go for it.
Laser vaginal rejuvenation and designer laser vaginoplasty. Healthy alternatives for a woman's well-being.